Hello, everyone, and welcome to another episode of Wisdom Chat. And today, my very special guest is Lyle Watson, who is a healthcare specialist with WPA. Lyle, lovely to have you with us.
Ajay, yeah, looking forward to talking to you. Thank you. Yeah.
Thank you. Lyle, tell us a little bit about WPA and the work that it does and what you do.
Okay. Well, WPA is a not-for-profit private medical insurer. Not-for-profit meaning that because we don't have any shareholders, we are only really interested in the health and well-being of our members. People ask me about not-for-profit, and it really just means that because we've been going 121 years and have accumulated reserves, the income that we're able now to take from our reserves covers all of our central overhead. It covers all of the advice fees, the fees that I get paid. And because we haven't any shareholders and we're not advertising, all that we seek to collect from our members is that which we believe we're going to have to pay out in claims. So technically, I don't really see how you can imagine we would get a cheaper premium if we've got no overheads, no shareholders, and we're really only just collecting that which we think we're going to have to part with, if you see what I mean.
Yeah.
So that's the not-for-profit bit. 121 years old, I've mentioned.
Wow.
So it does set us apart in the marketplace. And I do private medical insurance for both individuals and their families, and for businesses ranging from 2 to 2,000 people.
Right. That's excellent. I'm just thinking while you were talking then, Lyle, why would anybody need medical insurance or private medical insurance?
Medical insurance is very topical at the minute. WPA have had their best ever January. They've had their best ever February, and so on. Every month of this year has been our best ever of that month ever in 121 years. And it's because people are turning to private medical insurance now as a result of the fact that COVID hasn't helped, but the NHS, brilliant as it is, and indeed it is, if the matter in hand is not an emergency, then you just have to go to the back of a queue, which if you put the queues together in the NHS, it's over 10 million people waiting upon the NHS in some way, shape or form.
Yeah.
Avoiding those queues, that is why you have private medical insurance.
Talking about the queues, I was just reading yesterday the waiting list of, I think, operations, whatever they may be, was somewhere over 12,000 at the moment.
6.6 million people are waiting for hospital treatment.
Right, of any kind.
For a procedure, be it a theatre procedure or physiotherapy or whatever.
Yeah,
that's 6.6 million. But the queue is queues, if you total them together, are over 10 million, because before you get to your hospital appointment for a procedure, you've got to see a consultant.
Yeah,
which can take 6 months, 12 months. You've then seen the consultant. You've got to have a diagnostic test, be that an MRI scan or a CT scan or whatever. That could be another 6 or 12 months. So you add these queues together, it takes you to over 10 million people.
Yeah.
And the director of NHS England in November 20 went on the 10 o'clock news and made a surprising statement that if you are not an emergency, by that they define not likely to die within 48 hours, then you can no longer expect the NHS to be there for you.
Yeah.
Bold statement from the director of NHS England.
It is, and it's quite worrying as well, because I mean, the news items that have been at the forefront at the moment. So starting with, for example, ambulances. And people waiting several hours for an ambulance to arrive. And obviously we've had one or two stories in the news about the repercussions of that. But also in terms of, as you say, these waiting lists, they're phenomenal. And I know even in my sort of own local GP, it's not always easy to get an appointment. You may be waiting several days, a week, to actually get to see somebody. And
my wife came up a couple of months ago on a Monday morning about 10 o'clock to my office and said, I can't do this anymore. She'd been hanging on for 42 minutes, she said, with our local surgery to make an appointment to go and see someone. And I said to her, well, of course, you do remember, Ali, that we've got a remote GP service with WPA. So you just need to pick the phone up and get a GP to ring you back at a time that suits you. That GP will give you a prescription, will email you a prescription, or they will email you a referral to a consultant if that's the outcome. So she did that, she got a prescription by email before lunch, and she'd spent 42 minutes or 52 minutes, can't remember which, just trying to make an appointment with the GP.
Yeah.
So that's an additional service that is free with WPA, the remote GP.
I mean, that's excellent. And it just goes to show that there are ways and means in which you can get a more sort of immediate response to your particular need. Some people might say, well, isn't that undermining the NHS? If I'm going down this particular route, I'm circumventing those queues. And what about everybody else? I mean, I'm sure you'll have come across at times somebody sort of making a comment or something. But how would you explain to them the importance of what you're doing and why it would be beneficial for them?
Well, the reason that it's a two-speed system is that, and it has always been, is that when a consultant becomes qualified, they are asked by the NHS to contract to the NHS a number of half days per week of their time. So the NHS says to a consultant, newly qualified chap, your working week is in 10 half days. How many of those are you going to work in the NHS? So if he was a consultant radiologist, so the guy who takes the x-rays and the scans or whatever, his private practice might not be that great. So we might just give half a day to private practice and 4.5 days to the NHS. Whereas an orthopedic consultant, somebody who specializes in knee surgery, for example, he could probably do 10 half days a week private practice. But let's just say he splits his working week 50-50. So you go to your GP, or you use the remote GP with WPA. He emails you, or she emails you a referral to a consultant. With WPA, you choose which consultant you want to see. So if you ring the practice of the consultant, the details of which are on the WPA website, you ring consultant of your choice. And if you don't mention to the person at the end of the phone that you want a private appointment with the consultant, the consultant secretary will say, I'm afraid he can't see you for 26 months, but that'll be 26 months on Thursday at 2 o'clock. And you say, oh, actually, I'm with WPA, I'm a private patient. He says, oh, well, he sees private patients on a Thursday or Friday. He's got a 10:15 on Thursday or a 9:30 on Friday. Do either of those work for you? So we're talking about a 2-year wait or 3 days. That's your private medicine.
I mean, it's interesting.
The same guy.
Yes, and the thing that came to mind was, on the one hand, I can imagine some people who may not have private medical insurance feeling a little bit kind of put out by the fact that they have to go into that 24-month waiting list. Yeah. And but having said that, one of the things that crops up time and time again, people think of these as being quite expensive. And like anything, there's always, the backstories people have heard and the myths. And I mean, what could we say to our listeners that would reassure them about, that not just the well, not just the value of what we've talked about, but also the cost to them. And like you said, you were telling me the story earlier of how you then helped a business actually put in a scheme for all the staff of that business. So first of all, tell me. Tell our listeners a little bit about the cost side. I'm not talking about specifics, but just reassure them on that front,
Okay.
and then tell us a story about what you did for the company.
Well, there are only two drivers to premium. So it's the age of the individual. Clearly, the older you are, the more expensive you are to insure because you claim more often and the cost and value of your claims increases. So you would expect to pay more in premium the older you are.
Mm.
The other driver to premium is your location. And by that, I don't, postcode is what we take. But by that, I don't mean one side of the road or the other makes a difference to the premium. It is simply that because we are only seeking to recover the cost of claims, if you had a specific procedure code in Leeds, a hernia and whatever that code is, you had that surgery, then you would pay 100 units for that procedure in Leeds. But if you lived within the M25, the cost of that procedure would be 140 units. So because it's 40% more expensive to have treatment in London and surrounds, we charge London customers 40% higher premiums. It's simply the cost of claims being recovered.
Yeah.
So those are the factors, age and location. But if we said we were talking about people who live in West Yorkshire, for example, that's a block of premium priced, and a 30-year-old would pay about £30 a month for a sort of relatively basic private medical insurance policy. So yeah, it's not runaway silly money.
No, but from a business point of view, these are actually quite often they'll talk about perks or benefits to employees, and these things like the private medical insurance is actually a really good benefit for a company to have for its employees. Yes. Tell us a little bit about the story you were referring to earlier.
It's becoming a very competitive market out there, which I must admit, I don't really understand why, but it seems as though employment is at its highest and unemployment at its lowest. Yeah. And that's something I don't really understand given the pandemic. But because of that situation, people are really employers are struggling to get staff.
Yeah.
And one of the ways in which they can attract and retain staff is by providing them with a decent set of employee benefits. Now, that might be private medical insurance, but it could be pension, it could be life cover, it could be cycle to work, it could, whatever it happens to be. There's a whole spectrum of employee benefits. But WPA are seeing an uptick in the inquiries about private medical insurance as an employee benefit from the smaller businesses, because it is something that it is a way of the employer putting their arm around their employee and saying, look, we care about you, and we're going to pay for this 30-year-old on a group scheme. It's actually 25 quid a month because group insurance is cheaper, group rates, and it's also tax deductible. So the 25 quid a month that the employer is paying for this 30-year-old medical insurance is costing him 20 quid a month net of corporation tax. So again, it's not runaway silly money.
Yeah. And it's going back to what you're saying about the employment at the moment. We do have the highest employment level, but we also have the sort of the highest level of positions available, but not enough people to fill those, and that's why companies are really struggling. And I think one of the things that's really come to the forefront is people looking at how do companies treat their employees. So they're looking for the things that employers do to value their employees. Hence why there's probably a spike in employee benefits, including things like private medical insurance, and which in a way doesn't surprise me, because for such a long time we've had things like Glassdoors, where people can put comments about employers or previous employers, and even the CEO of the company has comments. And these are the kind of things that people look at. Now, I suppose for yourselves and WPA, have you actually seen a spike in companies wanting to pursue this? And if they are, how do they go about doing it? What's the kind of process that they would go through?
Well, all they would need to do is go onto the WPA website and type in their postcode, and they can get a quote themselves, or based upon their location, so their most local healthcare partner, of which I'm one for Leeds and Bradford, would make contact with them, ask all the relevant questions to get the information that's required in order to produce a quote. Once the business has a quote, they then decide the value. Yeah,
and make their choice accordingly, don't they?
They make a value judgment based on what the premium is, and what they find for a younger workforce is that they can bolt on to the private medical insurance policy benefits such as £200 a year of dental cashback for the employees, £200 a year of, as an example, at different levels, but £200 a year, say, of benefit for glasses and contact lenses. And given that an employer who is employing people to sit at a monitor all day has a requirement or an obligation to provide them with a sight test, that's included. So there's lots of reasons why the cashback extras that can be added onto medical insurance policies for not a lot of money. We're talking £7 or £8 a month, that kind of figure for those benefits per person, make a very worthwhile proposition for employees.
Yeah, that's wonderful. I'm just conscious, Lyle, time's passed us by.
I mean, shot past.
It goes quickly, doesn't it?
Yeah.
For our listeners who may be interested in this and want to pursue it a bit more, how could they get hold of you?
Well, they can get hold of me on my mobile phone number, which is 07886 660 705, or they're welcome to contact me via email to lyle.watson, so that's LYLE.watson @wpa-hcp.org.uk.
Thank you very much, Lyle. That's wonderful. And I hope that's been really beneficial for our listeners. I really appreciate you giving up your time to chat with me about this. Yeah, it's lovely to talk to you as well. And I know our paths will cross again many a time.
Yeah.
So enjoy the rest of your day, Lyle.
Thank you, and you. Bye-bye.
Bye-bye.